First off, we're going to do a quiz. So it's just a 10-question quiz, which will come on after this slide, just to, again, demonstrate to you, so you can demonstrate to yourselves how much or little you know about the normative values in these common sort of tests of exercise physiology. So a normative value is what to expect. So, it's something that's incredibly important when you're communicating with someone that you might be administering a test to. What do I expect for somebody like me? What is a normal value? What are the normal units for that value, so that they can start to understand and interpret their findings. So we're going to do a 10-question quiz, just to see, again, so you can see for yourselves whether you know as much as you should do. The next part is I'm going to talk about how to administer a test, so what information you need to provide to somebody if you were going to test them. So again, this is built on basically kind of a lack of understanding from undergraduate students of how important communication is when you're doing these types of tests. So, and this is completely understandable. It's understandable because you've already done 1 year of it, but it's also understandable because you're always testing one another. And so you have it explained to you what test you need to do, and therefore you don't really see the importance of actually fully explaining the test to the person that you're, investigating. When you have the background that I've had in working in hospitals with people that are coming in who, can be quite scared and have not been told very much by the person who referred them for a particular type of exercise test, you really get a sense of the importance of having really clear communication about, what they need to do, why they need to do it, and what the test result actually means. And so I'm going to give you a few examples of this as we go through, but it's something that all of you need to improve. And unfortunately, we're probably going to get less chance to do it this year because of the restrictions due to COVID. But, still, that said, putting it on your agenda so that you have some understanding about how important it actually is still, a worthwhile task. And then what we're going to do is I'm going to introduce you to some ballpark figures. So, it's not necessarily all about knowing the textbook number about what to expect for a particular person, or putting it into some sort of formula to tell you exactly what that person should get based on some, previous data. Sometimes it's just having a sense of what to expect, like a ballpark figure that, will get you kind of in the right place. That's often enough when you're actually testing someone, and then later on when you're really analysing the results, you can kind of go into more depth to sort of get a more subtle understanding of whether they've achieved what they should achieve or whatever else. So the first thing we're going to do is it's going to be this 10-question test, and then I'll sort of see you on the other side of that once you know how much or how little you know about these normative values. Right, okay, so hopefully you've done the test, and now you know whether you've got a really good sense of what to expect, or not very little, or not very much. The really important thing, and not to try and harbour on it too much, is just that you've done this for a year now. So for some of these variables, oxygen consumption, ventilation, heart rate, all of these things, you've measured multiple times in a lab. So you need to be asking yourself, if you don't know them, why don't you know them? You've measured them multiple times on yourself, on your friends. So if you don't know them or don't really have a sense of what they should be, it's because you've not been engaging in the labs. And so the lab sessions, the kind of the best learning opportunities, because you're actually physically seeing something happen, you're taking the measurements yourself. But if you're just a passenger in those sessions and you're not actively involved and you're not really trying to think about the information that's being presented to you, they can just pass you by. And one of the best ways to start getting engaged is to start making predictions about what you expect to see. So if you get somebody, like say on an exercise bike, and they tell you that they're fit, your automatic response should be, well, what would I expect their maximum ventilation for a fit, young person to be? And then measure them, see whether you were right or wrong, and then you can start to adjust your idea of what's normal according to that. And you need to do it for everything: VO2 peak, maximum ventilation, maximum heart rate, resting levels, blood pressure. Anything that you measure, you should be going in with an expectation of what you expect to see in that particular person. And if it doesn't match up, then you need to ask questions of, well, why doesn't it match up? Is it so far off that it might be an error? Does it indicate disease? Does it indicate a high level of fitness? Who knows? But the only way you're going to start to ask those questions is if you start to have an expectation of what you're going to find. So what we're going to do now is we're going to talk more about actually describing a test to somebody, like speaking to someone and telling them why they need to do something. So again, you take it for granted because you test one another that everybody's coming for a test and they all have an expectation, they all know why they're doing it. But actually in all of the scenarios that's not the case. So if you are working in a lab and you have an elite athlete that come through the door, you may think that they have an understanding of exercise physiology because they're an athlete, but the vast majority of them have got very little understanding. So you would still need to go through all of these processes and these questions that I'm going to take you through over the next 20 minutes or so. And even more so if you're dealing with people that are elderly or frail or scared, which are the sort of people you often get in hospitals, these questions are even more important, because part of your job is not just actually getting the measurements, but putting the person at ease to making sure that they can do the best that they can in the test that you're looking to administer. So the first thing you need to think about, because it's the first thing that they will be thinking about, is why are they doing this test? So when somebody walks into a room and you're expecting them to do a test for you, be it exercise or otherwise, the first thing that you need to get clear to them is why it's important that they do this test. And I think there's sort of 3 levels of why. And depending on the level of the person that's asking the question will dictate how many levels of why you need to go through. So I'll give you an example of that now. So the first why, let's say we're looking at a maximum exercise test because that's what our module's about. Well, someone could come in and say, well, why am I doing this maximum exercise test? And you could say, well, it's to calculate your VO2 max. Now, if you're dealing with another student, or if you're dealing possibly with an athlete that's had tests before, that might be completely enough to explain what's going on. And they might say, excellent, okay, I've been interested in my VO2 max for a while. That's great to know. Thanks very much. Let's get on with it. For other people, you might have to go a level deeper than that. So let's say you're measuring somebody that might have no idea about what VO2 max is. And so they might say, well, okay, but why do we want to know my VO2 max? And then you might say, well, it's to tell us, it's to give us a marker of your cardiorespiratory fitness. And to some people that'll settle them because they may have an understanding about what cardiorespiratory fitness is, even if they don't know what a VO2 max test is. So they might go, okay, yep, great, you need to know what cardiorespiratory fitness, or I want to know, and that's why we're doing this test, great. But some people will need to go even further than that because, for example, when I was working in the hospitals, I was testing sometimes people who are going for surgery, who might be quite elderly and frail and unwell. And so even saying that, they'll go, well, why do I want to know my cardiorespiratory fitness? I already know it's rubbish. And so in my scenario, I would answer with an answer sort of like, well, because cardiorespiratory fitness is linked to poor post-operative outcomes, and by understanding what your cardiorespiratory fitness is, we're able to better manage your risk following surgery. Something like that, because that's what they want to know. They're doing the test. They want to know they're doing the test so it can help them in their particular scenario, in that case, related to their sort of post-operative outcomes. So always thinking about the why. So when the person walks through the door, you shouldn't even wait for them to ask why they're doing the test. You should be telling them as they sort of, as soon as it's kind of reasonable to do so. And then the next one is, well, what does it involve? So once somebody knows why it's important to do the test, they're going to want to know what they're required to do. So I always give this daft example just to make the case, but if you went into a doctor's office and said you had a sore throat, and he said, well, drop your trousers because we're going to give you a rectal exam, you would kind of ask a question and go, well, why do we need to do that? Why does it involve that particular test? So you want to have an expectation, you want to know what's coming next. So when you go for an exercise test, to some people that can be quite a big thing. They might want to, they might not really understand why it's important for them to undergo that test anyway, or what's required within it. So if you just say, we're going to put you on an exercise bike again, and we're going to get you to exercise as hard as you can, for some people that might be enough, but for others you're going to have to really explain it step by step. What we're going to do is we're going to sit you on an exercise bike and connect you to this heart rate monitor, and we're going to ask you to put this mask on, which feels a little bit uncomfortable, a little bit like like you're going scuba diving or something like that. And once you've got the mask on, what we're going to do is we're going to monitor how much you breathe in and out every breath during exercise. Once the exercise starts, we're going to do or once the test starts, we're going to do 3 minutes of rest where you're just expected to sit there and do nothing. After those 3 minutes of rest, we're then going to ask you to cycle at a really steady pace for another 3 minutes where it's going to feel quite easy to cycle. Once that stage is finished, we're then going to start to do this thing called a ramp test, which is sort of like you're going up a hill, it gets steeper and steeper and steeper. And what we'd expect from you is for you to go as long as you possibly can, because at a certain point, you're going to feel like you can't turn those pedals long anymore. Once you get to that point, that's when the exercise test will stop, when you feel like you can't continue any longer. Once we've done that, we're going to do a quick recovery for 2 or 3 minutes just to bring your heart rate down, and then the test will be over. You know, it all depends on the person that you're speaking to, but they're going to want to know what the test involves before they undertake it, or before they decide that they're going to do it. And the next thing they might want to know is, and this might be before the test or after the test, but they're going to want to know what's normal for them. So, you know, if you say you're going to do an exercise test, usually afterwards they're going to say, well, what should I expect? What is normal for me? And this doesn't matter whether it's an exercise test, whether you're taking blood pressure, a blood measurement. It really is. It doesn't matter. They're always going to want to know that information. So you need to be providing that information before they ask. So it might be before the test, but sometimes it's usually afterwards, I suggest. So that might be, you know, you're going to perform an exercise test. It's going to take about 15 minutes. You explain it. We would expect you to be able to exercise for around 10 minutes. And the number that we're really interested in is your VO2 peak. And we'd expect that to be somewhere between about 20 and 30 milliliters per kilogram per minute. You know, the fitter you are, the higher that number is. The less fit you are, the lower that number is. So that's what we'd expect for somebody of your age and your gender, something like that. But they're always going to want to know that, and that's why we're doing those questions at the start, because this is so important for participants' understanding and sense that, you know, there's a reason and a point to doing their test, that you have to start engaging with it right now. So that's the next one. Right, and so we're related to this because if you want to start having a better sense and be able to, you know, give people an expectation of what's expected for them, you know, the way that you do this is you find previous papers that have looked at similar populations and tried to produce these things called normative values. Now, often these include quite complex calculations where you might put in, you know, their age, their height, their weight, their current training level, all sorts of things, and then from that it will spit out a number of what's expected. Now that's fine, and that's important to use that if you're sort of going to produce, you know, a report about their test. But when you're actually just describing and discussing with someone, they're not really interested in the exact number. They just want to have some sort of idea about what to expect. So the best thing to do is to start getting a grip of some ballpark figures so that you can start to engage with it a little bit more. And so the ballpark figures that I'm going to present to you for some of the key things that we look at are these ones that follow. So VO2, so oxygen consumption at rest, sits in and around about 0.3, 0.5 litres per minute. Now, that isn't the same for everybody. It changes. It particularly changes if you're bigger. You know, if you've got a bigger mass, then you usually need more oxygen to support that bigger mass. But for, again, as a ballpark figure, we might look at 0.35 as a number to try and remember. Now, if we look at VO2 max, well, VO2 max is highly related to your fitness status, as we talked about in previous lectures. But to get you to a ballpark figure of what to expect in litres per minute, what we can do is we can just take that oxygen consumption at rest, that 0.35 litres per minute, and times it by 10. Because if we times it by 10, we get to 3.5 litres per minute. Now, 3.5 litres per minute might be an oxygen consumption that you would expect in a pretty fit young person. So that ballpark figure wouldn't be reasonable if you were getting an 80-year-old. You would have to shift that number. But for your starting point of trying to understand what's reasonable, that's probably an easy way of trying to remember two numbers. So VO2 at rest, about 0.35. VO2 max, healthy, fit person, about 3.5 litres per minute. Now, as I say, that is a fit person. So you would have to sort of like alter that and change it over time as you've got more experience in what you would expect in the population that you're testing. Now we can do a similar thing for VE at rest. So again, VE at rest can change dependent on a number of factors, one of which being the size of the person. So the bigger the person, usually the larger their minute ventilation is at rest. But as a start point, we can take 10 litres per minute as a ballpark figure of what you would expect if you were looking at somebody's minute ventilation at rest. And so what we can do is we can say, well, let's take that number and again times it by 10 to estimate what a VA max would be, and we get 100 litres per minute. Now, again, VA max is dependent on many factors: size of the person, how much they can exercise, how fit they are, because you usually require a higher ventilation, or you achieve a higher ventilation if you're doing more work. So it's not unreasonable to see a fit, large person, a rower or somebody like that, get a VE max of 200 litres per minute. In somebody that's elderly and frail, it wouldn't be unusual to see one at 40 litres per minute. But as a ballpark figure, thinking about like fairly healthy, youngish person, a VE max of about 100 litres per minute is a reasonable number. So they should form your start point. And then what you need to do over the next 6 months while I'm working with you is every time you go into the lab, when you're measuring these values, have an expectation that you're going to see 0.35 for a VO2 at rest. And then if you're testing someone, and let's say it's a small, female, let's say, who only weighs 55 kilograms, well then you may well see that that number's lower. But then that will start to mean something to you, because then you'll start to go, oh, okay, so in smaller people, VO2 at rest seems to be a little bit lower than 0.35. And similarly with the VO2 max, if you test somebody and they say, no, I don't really do much aerobic exercise and they're fairly small again, then maybe their VO2 max will be a lot lower than 3.5 litres per minute. But then you'll start to make sense of that, because you might be able to attribute it to the fact that they're not very fit, or they do different types of exercise, or that they're quite a small person, whatever it might be. But then you'll start to be able to, alter and refine your ability to predict what you would see in a certain person. And that is the skill of administering tests to people, or one of the key skills. Now, just to take it a step further to try and make it a little bit even easier to remember, is to kind of associate these numbers that are fairly abstract to something that you are already familiar with. So, for example, a can of Coke is 330 centilitres, or 0.33 litres. So if you're trying to remember VO2 at rest, well, if you remember a can of Coke being 0.33 litres, that's pretty much the same as 0.35 litres. So if you know that and you go, well, okay, VO2 at rest, a can of Coke, 0.35 litres, then you can then all you need to do is go, okay, person. Now, once you've spoken to someone and you've done the test and they say, what would you expect from me? And you say, well, okay, I would expect you to have a VO2 max of about 3.5 litres. However, your VO2 max was only 2.2 litres. Well, the next thing they're going to want you to do is to interpret that result for them. So you can expect that they don't know what that result means. And so you're required to be able to have the understanding and knowledge to be able to make sense of that for them. So if that was me and I was testing a healthy person that came in for an exercise test, and I said I would expect it to be about 3.5 litres per minute, but yours was only 2.2, and they said, well, what does that mean? Well, then I would go on to explain that, potentially it meant that they were not quite as fit as they might want to be, and that maybe they would want to consider doing some aerobic training to try and improve that number, and that might be important for their overall health and for their kind of longevity, all of these sorts of things. But they're not going to be able to do that. If you take the average person off the street and say, okay, well done, your VO2 max was 2.2 litres per minute, see you next time, they're going to go away none the wiser. They're going to have no sense of what that test, the purpose of that test and why they did it. So it's up to you to make sense of it for them. The only way you can do that is to know what to expect for them, and then depending on whether their value is higher, lower, or matches what you expect, to be able to interpret that result for them. So to give you another example of that, if you come and you have someone, you measure their blood pressure, and you say, well, what's expected for me? Well, the first thing is, do you know what an expected normal blood pressure is in and around 220/80? If you don't, you're no use to them. If you do, you can say, well, that's what we'd expect for you. If their blood pressure is 160/100, well, then the next step is to be able to understand that that is higher than what would be expected for that person. And then you'd be able to, can you interpret that information and help them make sense of it? So by saying something like, that is a high blood pressure for someone of your age, or for anyone, I suppose. You know, a high blood pressure is negative for your overall health, as it's associated with you know, heart disease. So you may want to consider going to the doctors to try and understand the level of your hypertension, and maybe consider some medication to reduce it in the long term. Who knows? You know, like, it depends on the sort of circumstances that you're dealing with the person, but they need you to do that. They can't do that themselves, so you have to be able to interpret the result depending on whether it's higher or lower than what you would expect for that particular person. So just to summarize those things, and obviously this is quite a short session, but really, really important. The one thing I want you to take away from this more than anything else is that you'll not get better at this stuff just by reading books. The only way to get better at it is to start, when you turn up to labs and you have the opportunity to start measuring things, is to go through this really simple process. What do I expect this person to achieve? Then you conduct the test, you match up what you would expect with what they got, and then you start to refine what your own understanding of what you would expect in different circumstances. And then that in turn will allow you to start being able to interpret results more, because if you start to see fitter people get higher numbers, the next time you get a fit person and they have a high number, then you can explain to them, well, one of the reasons you might have had this high result is because you're, you know, a fit individual, so you do lots of aerobic training. But for most of you, you don't naturally do any of these things. You don't predict what to expect, you don't engage the results when you get them, and you don't consider what it means if somebody has a value that's higher or lower than what you would expect. And they're all just the most important things you can do when you're actually looking to administer tests. Right, so with all that said, as always, if you've got any questions about this session or anything else to do with the course, post your questions alongside this week's discussion forum, and I'll do my best to get back to them as quick as I can. I'll obviously see some of you in the labs, and I will be sort of, you know, hounding you about some of these things each week, and I'll see you next time.